Hello, good afternoon, good evening, good morning, and welcome. It's Nurse Richard, the Wax Wizard. Thank you for joining me. Bit of a gooey, slimy one this today. It's a nasty infection from this chap who came to see me, having all kinds of trouble, mainly not being able to hear, and he was also getting a bit of pain as well. Unsurprising, really, because it's quite a nasty infection, and any other ear specialist who does this kind of removal will tell you it is probably one of the most difficult things to do, because it's so delicate. You have to be so precise. I've actually not included the first for a couple of minutes of this procedure. Reason being is the ear canal was so humid and warm that there was just so much warmth in the ear canal that it just kept fogging up the camera all the time, so it was really difficult to see, which is still a little bit the case now, but it will become a little clearer as the longer that suction tube is in the ear. It kind of reduces the humidity, basically sucks the warm air out, so you're able to see it a bit clearer, and there's some lovely appealing stuff on the eardrum. It's got a little bit clearer now already, can't you? And yeah, it's so difficult to do this, because it's really difficult to peel this stuff away without touching the ear canal, because that's not what you want to do. This is all done in the really sensitive part of the ear. There's no fatty tissue between the skin and the bone there, so if you make contact with that, the patient will know about it, and they will let you know about it as well. Look at this, peeling away, but it's so difficult. It's almost impossible to get a spotless ear for procedures like this. There is a crust right on the eardrum there as well. It's impossible to get a spotless ear, but I was quite happy with what we did manage to do, because the main thing is clearing this in preparation for being treated. And the treatment for this would be an antibiotic spray. And because if you didn't do that, you just remove this, the infection would come back. You'd still get this discharge and this kind of dried up pus and debris, and it would come back pretty quickly. So the main aim is always to get as much as you can to prepare it for the treatment. It's many types. So the umbrella term for this is otitis externa. I know a lot of you will already know that. External, outer part of the ear. And otitis media is infection in the middle ear space, behind the eardrum. There's a few bacteria specifically. I'm going to get a little technical here, not like me. Technically, a few bacteria that are responsible for this. These, I would say, 4 main organisms that can cause otitis externa. You have a couple of bacterial ones and then a couple of fungal ones. You can also get a mixed presentation too, where there could be a bacterial and a fungal infection as well. But the most common bacteria is probably Pseudomonas, and then you can get Staphylococcus or Staphylococcus aureus. Sounds like a dinosaur, doesn't it? Staphylococcus aureus. What do you call a blind dinosaur? Do you think Theosaurus? There you go. That's your dad joke for the day. I haven't got my book ready. Nice little peel away from the eardrum there. But the more common one what was I saying? Yeah, so Pseudomonas, which can be quite difficult to treat with antibiotics. I think from my knowledge of it, it doesn't do well with broad spectrum antibiotics and penicillin and what have you. It tends to work better with antibiotics that usually end in icing. So I think the spray that you can get from for this one contains neomycin, which is better at dealing with infection like this. If there is an element of Pseudomonas there, I'm in two minds. You never know unless you got a swab, and that will tell you which one it is. But the neomycin should deal with both pretty well. And the other two main organisms in otitis externa is you can get a fungal based, of which aspergillus is probably the most common. Less common is candida, which is kind of like a creamy discharge. Both not very pleasant. But we're just going to try and peel away this from the canal wall here, which, like I said, is so difficult to do without touching it. But there's a bit before and after shot as well at the end of this, and the reason why I've done that is it won't be squeaky clean. Never is when you're doing something like this. You could literally spend all day in someone's ear when they've had infections like this, and you'd never get a squeaky clean ear. But I was very happy with the point we got to. And you have to remember there's a real person behind this. It's not a model, it's not a dummy, they're awake. And obviously there's only so much that somebody would be able to tolerate. You know, you don't want to hang around in someone's ear with sharp implements longer than you should. But I was delighted with the result of this one. What have I been up to? What else can I tell you about this? I've told you enough about this here. What else can I tell you? Yeah, I've been very busy recently out of doing this. I'm still in the middle of developing a training course. More to it than you think. Just writing the manual is taking a very, very, very long time. But I'm getting there. I'm not going to train just anybody, like a lot of these providers are. Absolutely not. Just I probably mentioned this in the last episode, but the podcast channel is up and running. I've got the first episode already in the can, so to speak. You're going to go and search that up. It's called the Unlikely Legends Podcast. And the first guest is my dad and his friends, because they are legends. They've got some stories as well. Plenty of celebrity name drop clangers as well. So I hope you'll enjoy that. So feel free to go and subscribe to that channel. What else have I been up to besides that? Yeah, I've been doing quite a few gigs as well with my dad's band, because I have a bit more free time on my hands nowadays. And he's been going out gigging for absolutely donkey's years. And he said, "Oh, why don't you join us for a few every now and then?" So that's what I've started doing, and I've been enjoying it too. If you remember, you can see them as well. You members will know this. In fact, I did a gig last night, and I managed to figure out a way of live streaming it. Right? Not just watching us, because you don't want to see us doing the same tunes all the time, because they're usually at like jam nights, acoustic nights, so you can see other artists as well. A lot of really fabulous artists as well around here, some very talented ones. So you can see some of that. If you're a member of the channel, which feel free to do so. What else? Still in training for the run that I'm doing in aid of Alder Hey Children's Hospital. Got a bit slack on the old training recently, though, I must admit, because I've been busy with other stuff, but I'm hoping to get back into it. But by hook or by crook, I will finish it. The hospital actually did get in touch with me yesterday, because they noticed on the fundraising page how much we'd raised, and a lot of that was thanks to you guys. I think it's over £2,000 we've raised for it so far. And they got in touch and they said, "Goodness me, you've got a lot of followers who are very generous, haven't you?" And they offered me a free T-shirt to run in, which was very nice of them. So I'm just again doing some really delicate stuff on the eardrum here. It was not the easiest spot to get to this in the top left. You kind of are trying to hover over it and not touch it if I don't have to, because it is a little bit angry, this eardrum. But as long as we can get a few little bits away, then when the spray gets in there, and you have to let it sit in there as well when you put these sprays in. And if you've had an issue, you need to get drops or sprays in. Best way to do it is to obviously lie on your side, pull your ear upwards and backwards, put the spray, the dropper in, inside, squirt it in. What is important is you stay there for a good few minutes, 10, 15, 20 minutes. So that's what it's looked like before. It is just important to tip the other way after that time has come up to allow it all to dribble out. So yeah, you saw them before and after there. Big difference, and hopefully the spray will clear up the infection and it doesn't return. Anyway, I hope you enjoyed that. But for now, take care of yourself and I'll see you soon. Ta-da.